When people talk about trust in the patient-clinician relationship, the trust has two components. You start with being empathetic, compassionate, but also, that's equally important, the expertise that you know what you're doing. Somebody like Dr. Melton Mew.
So I'm a colorectal surgeon, trained first in general surgery and then did a colorectal surgery fellowship. I first trained in surgery, knew I loved the combination of problem solving, patient care, and I also started to take care of patients with Crohn's and ulcerative colitis.
I was diagnosed in 2002, and so I was actually a student here at the U in law school. At first, my disease was manageable. Like, I had some ups and downs, less ability to control my bowels, which is, for me, was the most debilitating. My worst time of day was in the morning. So I knew that if I had any early meetings, that would super stress me out because I would have to be on the toilet for like 2 or 3 hours sometimes. And even then, not necessarily guaranteed that I would like make it to work without an accident. And my flares became more frequent. So at the time, my gastroenterologist was like, let's see what's going on. At that scope, it showed that my disease had spread throughout my whole colon. That's not the ideal situation to start considering surgery because I was 6 months pregnant and the baby would have been very premature and it would have been a very high-risk pregnancy to both me and the baby. So they checked me into the hospital and it was like a godsend. I was here at the U and I got a multidisciplinary team. So it was the GI team, the colorectal team, maternal fetal medicine, and endocrinology, which is a huge relief to me because the fact that like I was in one place and everybody got all the same information and was talking to each other was huge.
There's so much information in medicine, or trying to say, here's information that's really relevant to this patient and in this case.
And everyone knew that it would be better for me not to have a colectomy at that point in my pregnancy. So they got me on a new biologic and these high-dose steroids and somehow stabilized me, like quieted things down. And the baby made it and he was fully healthy and almost full term. So that's when we started talking about surgery.
Once the area that's very diseased is removed in the people that do need that, we can do this really amazing reconstructive option. The idea is that you take out the last 6 feet of the colon and the rectum, and we do a reconstruction where the small intestine is brought all the way down near the exit point.
I felt awesome after I got my colon taken out. It was like I totally changed my life. I felt good, I could eat whatever, I could be active again. I'm just like a regular person now.
It's a great surgery, and I think it was a lot of ingenuity and creativity on the part of, surgeons that came before me. I think that surgery is a little bit of both art and science.
These two things come together and mediate the repair of the body and give people time to live your life again.
That relationship and being able to help people to have as best quality of life that they can have is a really, really special part of what we're able to do.